Gynecologists, what is the nastiest thing you have experienced while working? I worked as a medical assistant in a gyno office, and the worst patient we ever had was actually really sad. She clearly hadn't bathed in about a week and her underwear were stained. She claimed she was having trouble getting pregnant and had a bunch of eggs frozen and wanted a pelvic exam. The smell when she took her pants off was horrific. I'm fairly certain she had mental problems because she proceeded to tell me that she knew how to kill a man and get away with it and could help me out if I ever needed it. Then there was the time I had a 98-year-old patient with severe uterine prolapse. It was horrifying and made me never want to get old. The most interesting thing I ever saw was a patient who was originally developing as a fetus with two vaginas, but they ended up fusing together, leaving her with a string of flesh that divided her vagina into two sides. She didn't know about it until she was 19 when the doctor had a difficult time putting in the speculum because he stuck it into the side of the string that was smaller. Before that, no one had ever noticed TL. Dr. Dirty Crazy Lady Vagina, 98-year-old whose uterus was falling out, and a girl with a flesh string dividing her vagina into two sections. Okay, here you go. Was doing clinicals at a large inner-city clinic attached to a hospital. The first patient of the day was a woman in her 50s who had recently had a vaginectomy to try and combat vaginal cancer. They had gone and removed her entire vagina. I've never seen anything like it. After we removed the packing, it was just a huge, gaping, dripping maw in between her legs. There was absolutely nothing left of her female anatomy. The worst part was how terrible she felt about the whole thing. She refused to let her husband see anything, and was in tears the entire time, telling him he should go. She doesn't deserve to have him now. For the most part he just cried, attempted to hold her hand, and told her he loved her and could never leave. I had a Bartholin gland cyst the size of an orange that took over my vagina in a matter of days. Had to be hospitalized for 5 days total and I couldn't walk or sit up. Excruciating pain. Let me tell you, the doctor was so impressed by the size and I guess disgustingness of it that she invited student doctors or whatever to observe. Shit sucked. Glad it's gone now, but I'm sure I horrify everyone with that. I remember my regular obgyn shrieked when I showed her and said, I can't fix this, or now. My wife's an OB/GYN. The worst case she related to me was a female inmate that had such a bad case of genital warts that it was impossible to discern any specific anatomical structures. It was just a giant mass of warts and infected discharge. She was also 10 weeks pregnant and still sexually active. My dad is a gynecologist and told me this story. He treated a girl that had Trich green, foamy discharge who had it for months before coming in. He told her to take the medicine right away and continue it completely. A few weeks later she comes back in, and she still had the green foamy discharge. My dad asked why she stopped taking the medicine and she said, well, my boyfriend really loves the taste. I gagged so much. Was chaperoning a procedure my doctor was doing on a woman. She had an ingrown hair that had turned into a cyst on her labia. This doctor wasn't particularly good at cyst extractions and busted the sac. It sprayed in his face. I was retching and trying to console the poor woman. At the same time, she was crippled with embarrassment. My mom's a labor and delivery nurse, so she sees quite a lot of cooch and swap stories with gynos all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy shit they stuff in Easter baskets out of a vagina. She didn't ask and the patient didn't explain. Friend of mine in judo class did some of his GYN rounds at a local homeless shelter clinic type deal. He'd routinely horrify me at practice. Worst situation he was in was this homeless woman who had a rainbow of colors coming out of her vagina, each color distinct, didn't smell good. He didn't know what the hell to make out of it, so he called in his preceptor, who was equally baffled. They ran some tests on her, and it turned out she had something like a dozen simultaneous infections of her cooch. My stepdad is a retired obgyn with 45 years experience. He told me the worst case he ever dealt with was a patient he performed a hysterectomy on just after he finished residency. and put the paperwork down he needed for board certification. The examiners noticed that a few days after the surgery, the patient needed 7 units of blood. The examiner was obviously concerned. So my stepdad explained to him that the woman's husband raped her days after a major surgery and she almost died. He still says that's the grossest situation he's ever been a part of. Edit. My stepdad saved her life and passed his boards. I doubt anyone will see this, but I used to work for a urologist. And one night he was on call for the local hospital and a morbidly obese woman came in with painful urination, hematuria, blood in urine. Due to her size, they decided to put her under anesthesia and do a cystoscope to see if there was anything unusual about her bladder. And once they had her on the table, the doctor spread her legs. He said the first thing that hit him was the smell. It was atrocious. He went on to find what looked to be a smashed and rotted sandwich in the folds of her buttocks and thigh area. Once the patient woke up from the procedure, he asked her about it and her reply was, "Oh yes. I did lose a sandwich a couple of weeks ago. I just thought I ate it and forgot." This is a true story. TR. A urologist I used to work for found a rotted sandwich in a lady's ass. Thigh rolls. Not a gyno. But during an exam, an NP who did OB-GYN stuff told me she had to remove a month-old tampon from inside this chick's bag. She has forgotten to take it out. Had banged her husband and everything without him noticing. And the smell eventually brought her in. And cramping. It had like glommed onto her tissue. Fuck nasty. As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was labor. After several attempts, I just could not get an accurate view with the speculum, due to the sheer size of this lady. As such, I had to call my resident in for help, as the resident attempted to do a speculum exam on this patient. Her first couple of attempts were unsuccessful as mine had been. However, on her third attempt she was able to pass the speculum into the vagina cavity. Then the patient all of a sudden started screaming really loudly. We weren't really sure what had happened, but upon closer inspection, the woman's penis, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I have ever seen. My wife isn't a gyn, but she performed PAPs as an NP. One patient came in claiming her crotch reeked. She claimed the smell got worse and worse over the past week or so. My wife had a look, used a speculum, and then with forceps fished out a tampon with them. Evidently, the woman had sex towards the end of her period and forgot she had a tampon in. My wife said it was the most awful odor she ever smelled. Keep in mind that part of her schooling required her to play around with a cadaver her university had for over 30 years. TL. Dr. Woman's post smelled worse than a dead body. Not a gynecologist, but I've wanted to share this. 3 or 4 years ago, my buddy in college was finger banging a girl and literally pulled a used condom out of her vagina. The worst part is the chick didn't even notice, so he just stuffed it back in there and said he had to leave. I worked for a family practice as an MA for a while. A patient who we had never seen before called the office frantically trying to schedule an appointment because she was having lady issues. Whatever, we got her in the same day, and after the doctor had talked to her for a while, he told me to prep a pap room. When we walked into the room, the smell hit us like a ton of bricks. The doctor did a few throat clears and sat down at the end of the bed to start the exam. Well, after getting her feet in the stirrups, he lifted her gown and his eyes went from normal to about the size of dinner plates. This girl had the most severe case of herpes I had ever seen. Her vagina was swollen and a deep red color, covered in a severe outbreak. To make things worse, the piercing she had in her clitoris looked like it was being sucked in by her skin. Her vagina was oozing green and black gunk, and when the doctor inquired a perineal tear, she responded, "Yeah, haven't you ever heard of double penetration?" After the exam was over, we had to convince her that her current sexual partners needed to be contacted about their exposure to several STDs, even though, as she put it, it was too late anyways because she never uses a rubber. I have never seen anything so disgusting in my whole life. It still haunts me. My father's experience is not really nasty but pretty terrible. My dad is on call and is called in to stitch up this girl. 16 years old and goes to a rival high school of mine. He spends 2 hours or so, I guess that's a long time. I don't know, really stitching her up from her belly button to her anus. Somewhere along the line he notices that she was pregnant. After he is done, the father of the girl was there and my dad just says, "Where is the baby?" Father freaks out and screams at my father. "WTF are you talking about? My daughter isn't pregnant!" Scream, scream, scream. Cops go to the girl's house and find the baby in the closet with a sock in its mouth. Guy freaks out, asks my dad what he should do. My dad just says, "Get a lawyer." The girl got off too. Not an OB/GYN, but my friend's mom is an obstetrics nurse. And apparently, a woman came to the hospital complaining of stomach pains, and upon a pelvic exam, they discovered she had gone into labor and the baby had gotten stuck in the birth canal and died for days. Previously, the poor thing's arm was hanging out. The woman claimed she didn't know she was pregnant and didn't notice anything going on, whether it be labor or a freaking arm hanging out of her, due to the fact that the baby never took a breath outside of the womb mother's body. It was classified as a stillbirth and nothing happened to the woman. In regards to legal interaction, I passed out. Prostitute was brought to our via EMS. We needed to put a catheter in her. When we opened her legs, we saw a flash of green in her vagina. Turned out to be a bank roll of mostly 1s, 5s, 10s and a few 20s. I stopped carry a lot of cash now. Think about this the next time you give your kids lunch money for school. You truly never know where it has been. I worked at an OB/GYN office for around 6 months as a secretary. One of the doctors told me about a woman who had severe pain located in her lady parts. And once he investigated, he found a sweet potato that was actually sprouting inside of her vagina. Once he removed it, she explained that it was apparently a home remedy to cure a yeast infection she had. TL. Doctor, use monostat, not sweet potatoes, ladies. I work at a hospital in England. A story was told to me the other day of a lady who came in with a toilet brush stuck inside her, placed by her kind husband. Now she has it in for days, before gaining the gumption to come to a +E, where they tried to remove it. However, even the surgeon could not remove it. They realized it was somehow twisted around her femoral artery as it had gone through her uterus and abdominal cavity, impossible to remove without her bleeding to death. Within days of this, the DRS found she had septicemia, as they assumed the toilet brush hadn't been cleaned before inserting. She dies a quick and painful death. TL. Doctor, lady's husband inserts toilet brush. She dies. Thank you very much for watching. In the comments below the video, gynecologists can write what's the scariest thing you've seen. And don't forget to watch our other videos.